how can we incorporate genetic testing into a physician's practice? That's one of the things that we have been asked quite a few times. So I think there are two main aspects where a physician can actually incorporate genomics and help their patients better and prepare more precise treatment protocols. One is in the field of pharmacogenomics, and the second is in the field of predictive analytics. So pharmacogenomics is nothing but there's a lot of studies done. There's a lot of evidence which has been approved by FDA for certain medications. Luckily, a lot of them are the common drugs that we use for conditions like diabetes, high blood pressure, cardiac conditions. So when we do a genomic analysis for our patients, we can look at which drug they respond better to, or for which drug they have less chances of side effects. We can also at the same time look at the evidence, like how many studies were done, how many people it was done on, what was the population breakdown. So based off of those things, if we are prescribing our patients a particular medication, say metformin for diabetes, the chances that the patient will respond to that is much higher. So we as physicians don't have to go to polypharmacy, which is prescribing multiple medications, having them come back again, or change the drugs. So that makes both physicians' life happy and the patient is of course very happy. The other area, predictive analytics. We can treat all patients the same way. We know that some patients, they just progress really fast. Some patients, even if their numbers are really bad in the beginning, but they just tend to stay there. It's hard for us physicians to figure out right from the beginning how aggressively we need to treat them. Should we be screening them every 6 months, 3 months, yearly? So these are the things that we always face a dilemma with. Genetics is one aspect which strongly affects how the disease course is going to be. Thankfully, now with the amount of data that is out there, we can make those predictions for lifestyle disorders, for neurological conditions. A lot of them you can actually tell ahead, figure out, okay, now this patient looks like he's going to have a complicated course. So let me start aggressive. I'm going to screen this patient every 3 months, get the blood work done, and I'm going to start on this medication right away. I think for us physicians, that's one of the area where it really add value to. And I think oncology, it's more evolved, right?
Yes. And of course, to add on to that one, the oncology, when it comes to oncology, so what Dr. Hima was talking about is testing of germline mutations. Germline meaning we are born with it and that is our DNA. But when it comes to cancer, the testing is little different. What we call is the somatic testing. We test the tumor. We take the tumor sample and then we do the sequencing of this one. So right now, major pharma has adapted to this science a lot across the globe. So if we look at the statistics, in the last 3 years, all of the FDA approved major drugs, 90% of them are targeted treatments. And all of these came out just because they were doing research on somatic mutations in the cancer. So there are almost, as of today, there are 394 new drugs which are targeted therapies, which are in phase 3 and phase 4, which are going to hit the market in the next 3 to 4 years. So which means because of this genomic science, most of the cancer treatments, now we are not looking at grand scale chemotherapy, the same chemotherapy to everybody. We are looking at targeted treatments. If you look at the recent publication, there is a trial which says 100% success rate with one drug. So they chose the patients who have this mutation and then they tested this drug on them, and to their amusement, they found 100% of them are cured of the disease. I'm not talking about remission, they are cured. So this kind of science is evolving. So right now, we need a deep analytics and deep testing. The standards should be very high at this time. We need to gather the data. We need to measure these outcomes. So we have to do all the tumor samples. We have to sequence the RNA, and we have to collect the data. What is the outcome? We tested this new targeted therapy. What happened? So this kind of collection of this data will become key to measure the outcomes. So the genomic science is evolving as we talk, and the bigger adaptation, as Dr. Hima mentioned, is into oncology. Most of the oncology sample. So right now, out of every 10 sequencing that we do, at least we are able to provide a targeted therapy for at least 4 of them, which is almost 40% of the people who are getting this test done are directly being benefited. So especially we do this test in stage 4 cancer. So it is very impactful. The lifespan of lung cancer in 5 years back or 6 years back, before the advent of EGFR gene targeting therapy, it was 1 year. Right now it is 4 years, especially for these patients who harbored this mutation. So it is of significant change in the quality of the life. And all these targeted treatments are not like regular chemotherapies where there will be a lot of side effects. These medications are oral medications specifically targeting what are the driver mutations which in the first place caused this cancer. Once you target them, the outcomes are better, and it is only evolving. I think going forward, the gene sequencing for all solid tumors will become standard of care.